Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobby Bagley, Chief Public Health Official and Director for the City of Nashua's Division of Public Health and Community Services. And I'm here today with Iraida Munoz, who is our Public Health Equity Officer. And we're going to talk about some of the things that have happened during this month as we close out Black History Month, remembering that celebrating the accomplishments of anyone that has contributed to the growth and prosperity of this country is something that can be done anytime and all year round. Iraida had the opportunity to work with Harbor Care as they produce a social justice presentation for the community just last week. So we're going to talk about that. We're going to talk about some of the tough conversations that we had to have and how that relates to public health. Iraida had the opportunity to collect and present data on housing, homelessness, and some of the inequities that we do see with our racial and ethnic minority populations, as well as the high costs of rents and housing that make housing unaffordable for everyone. As the Health Equity Officer, Iraida has had the important role of being a thought leader and helping us stay on top of addressing issues using an equity lens, which is really important. And it's unfortunate that right now we have executive orders that are coming from on high to dismantle a lot of that great work that has been done over the years in our country that has brought us so far forward, and at this point is looking to take us so far backwards. Some of those executive orders are also impacting federal funding that is leading to employers or workforce decreases, jobs being lost, that's impacting those who receive Medicaid. So we're going to talk about a lot of those issues this morning, this afternoon, today, whatever time it is for wherever you are, because those are the matters of public health. And those are the things right now that have me in a state of, I want to say, being fired up about the work that we do, because our job is to promote, protect, and preserve the health of the public. And it's very hard to do that when you have someone that's working counter against that very thing of keeping our community as safe and as healthy as we can. So Iraida, thank you for being here.
Thanks for having me.
It's really important for us to talk about some of the topical areas that were covered in the social justice Black History Month moment that Harbor Care put on. And the event was called Inspiring Community Resilience. And there were several keynote speakers who shared very important stories from their own experience and also talked about the impact that they can continue to have with community members. So your panel included the Honorary Harvey Key, who is a former state rep and a Korean War vet. Honorary Linda Gathright, who was an alderman for the city of Nashua, who still is a representative at the State House. Anthony Poore, who is Anthony has been an advocate for social justice issues for a while, ever since I've known him. And he is the president and the CEO of New Hampshire Center for Justice and Equity. And you had Brenda Lett, who actually lives in Manchester, but she's also a person who goes to a church here locally in Nashua, and she's the executive director of the New Hampshire Black Women Health Project. So you pulled this panel together to have these really important conversations at Harbor Care's second annual Black History Month social justice celebration. Can you talk with us a little bit about why that was important? What made this list of panelists important voices that you all wanted to hear? And I know that it was the Justice, Equity, and Diversity and Inclusion Committee at Harbor Care that included the co-chair of Jamaica Lewis,
Yes.
Lena Rieves, and Catherine Reyes, who were also a part of this planning team with you. And then you actually got a chance to be one of the speakers. So talk a little bit about that event and why was that so important, especially right now with all the things that are happening, not just in our country, because the things that we do here in the U.S. also have an impact internationally.
Yes.
And public health things, public health is local, but there's also global and international public health. And some of what we do in any country impacts every other country on this earth.
Yeah, thanks for the question, Bobby, and thanks for the invitation. Yeah, so it's all credits on them. It was an event that they organized. I was part of their committee and planning committee, and I want to congratulate them because they did an excellent job. I was part of their committee, and I contributed with some ideas. I congratulated the organization for sponsoring an event, especially on these times, because we all know that these executive orders, as you're saying, are affecting some decisions, especially in the higher ends of all the organizations, especially nonprofits in all the states of the United States. So Harbor Care, fortunately, was able to collaborate and allow this opportunity for to celebrate, to highlight the Black History Month, because there are contributions that we cannot avoid. It's part of the history of the United States. So this is the second time that happens, as you said. The first time was excellent as well. You were part of it. And it was an amazing opportunity for me to be part of the planning committee. We wanted to have a correlation between what is the number one subject, which is what everybody cares now, which is the issue of housing. The housing situation in our country, especially in this area, in Nashua area, is very concerning right now. There's no inventory.
No.
We all know that, right?
And what's the inventory rate right now here in Nashua? Is it at 0.1, 0.2?
No, not even 1%. We're talking about 0.3%.
0.3%.
It's less than 1%.
Right. And you need to have at least 3 to 4% of housing inventory in order to have housing available for all different types of
We need to have at
dwellers.
least 5% to be considered healthy.
5%.
Yes.
I said 4. Yeah.
Yes.
So 5%. So we're very far away from that.
Very
And,
far.
You know, we are seeing that the effect of that in our community with the number of individuals that we see that are unhoused, and then also those whose housing is threatened and causes instability in their ability to maintain their housing.
Correct. So we are fortunate enough to count with a public health department that has taken in consideration this matter very seriously. And our folks, our community health workers this year did a great job getting out in the point in time count task this year, and we went out and we did the job.
Yeah.
We actually went out in January, and for those folks that don't know what that means, is there is one day in January we go and count one by one who is unhoused.
Right.
And we don't have those results yet for 2025, but we do have the results for 2024, and we saw an increase.
54%.
54%.
Yeah, I think it was either 52 or 54%.
54%.
In the increase in the number of those that are unhoused counted in New Hampshire. You know what's also very interesting is that point in time count. This is something that comes out of the Housing and Urban Development HUD, you know, at the federal level. And I've been reading this book, and I'm still reading it. I haven't finished it yet because you know me, I'm always reading like 2 and 3 books at a time. I'm actually reading 3 right now. I'll tell you all 3 of them.
Yeah.
But that's one of them. It's called Housing is a Homelessness is a Housing Crisis.
Yes.
And it does focus on the point in time count. And one of the things that I did read in the book, and these 2 researchers are still doing work right now in several communities, because you actually have to look at your housing situation city by city, town by town, because each city and each town is unique. And one of the things they highlighted was the fact that this HUD implemented point in time count started back in the 80s, so it's been over 41 years. So it was in 83, 84 that they did the first one. And over the 40 years, they have seen and have identified that this point in time count is not an effective way of truly measuring
Correct.
those that are unhoused in our communities. First of all, for us, it's in January, right? And what we learned was that individuals that are couch surfing, meaning that they're inside someone else's home, even though they may not have a stable place of living, if they're sleeping on someone else's couch, they're not counted as homeless.
Correct. So if they are not counted as homeless, that means we are forgetting about those. The other thing that is considered is, so that means that the people that we're just counting are the people that are truly sleeping in tents or they are in a shelter.
Yeah.
We are not counting people that is couch surfing, which means the people that is staying here and there or staying with friends and folks. So how do we know that
Right.
that people and those people are considered to me homeless?
It's unstable. Yeah, well, it's unstable housing, right? Because
Unstable.
if you have to couch surf, it means you're couch surfing. It means you're riding a wave for the next couch that you can sleep
Correct.
on.
Correct.
Right? And there may be, maybe you're staying at a friend's house, or maybe you're staying, with your parents, and then you're with your aunt, and then you're over here. You're couch surfing. That's housing instability, right? And so we know that that number is huge, and the fastest growing population of that is young people.
Yep.
And what we've seen in the past couple of years is an increase in individuals over 60, 65, older adults that are now finding their way outside.
Older adults and young people, which is sad to see, unfortunately. And this is what really, it's so sad to see when we see the most vulnerable people increase in numbers.
Right.
So when you analyze the data and when you see those numbers increasing and you see that the most vulnerable numbers increase, what do you do with that?
Yeah.
So I wanted to highlight the intersectionality in between housing, our housing crisis, the lack of inventory, and the issue with health. So how does that impact our health?
Right.
Of course, we all know if you don't have money to pay your rent or your utilities or money to pay for your food, how are you going to pay attention to your health?
You're not.
You're not. at all.
Maslow's hierarchy of need says those very basic needs have to be taken care of first, right? So safety, housing, if those things aren't taken care of first, as you said, how am I going to actualize myself to think that now I'm going to plan for the best health I can have when I'm living day to day and I don't know where my next meal is coming from? I don't know if I'm in a safe environment, especially when I'm unhoused. Right? We've seen some data that shows that individuals that are homeless have a 900 times higher rate of trauma and violence against them than anybody else in the general population. 900 times.
Not even think about escaping about poverty and how am I going to think about a higher education if I don't even know how am I going to pay my rent?
Right. Or you're living
There's
day
no
to
way.
day.
There's no
You're
way I'm
living
going to think about those things.
week to week. Exactly.
If I
And
had to
so
have 3 jobs.
you had the opportunity to share some data, Iraida, and I'm not sure what to you were the highlights of that data that you want our viewers to understand and know. Again, these things that are really important public health matters, because right now with all of the changes that are happening and all the execution of these new policies that are coming down, they're impacting workers, right? And we're losing a workforce.
So
From the CDC, from the NIH, from the FDA, from places that have always given us the information that we need to know to put better programming in place.
So the other sad side of the coin that I wanted to highlight is if there is no inventory to buy, there's also no inventory to rent, right? That's the other
So
side
you're
of the
saying
coin.
the inventory, when the inventory is lacking.
Yeah, exactly. If you don't have a house to buy because you don't have the money to buy, you also don't have the money to rent. So what do? Well, you pair up with someone else. So you go try to rent a space with someone else. And there's also no opportunity for you to rent an apartment. But if you try to rent an apartment and you're trying to get a 1-bedroom, let's try to say you try to get a 3-bedroom apartment because now you have 2 or 3 people trying to, put together some money. There's 0% of opportunities for you to try to get an affordable 3-bedroom opportunity here in the Nashua area. But the city of Nashua, fortunately, is putting together plans to have some housing development opportunities in our area to make it work. Some incentives are in place for some developers to see if that can help the economics in our area. So there's some hope there. We're very hopeful that that could be something that helps our economy. Other initiatives that the city of Nashua has put in place is the new opportunity of a housing officer that has been very successful. As you know, we have opened the warming station for the winter months, that runs until April at the middle school, at the Elm Street Middle School. And that is just to preserve the people's lives that are unhoused right now. So those are some of the things that we have done. We have run some listening sessions just to consult the community to see what are the needs that our people has, right? So we need to be very aware of what's going on and put plans in place, work on strategic planning, and really take action based on the needs that we're seeing.
Yeah.
So that's some of the things that we're doing.
And I think one of the other things, Iraida, that you talked about was the percent of a person's income that they're spending on housing. And anytime that's over 30%,
Yeah.
that's too much.
It's
Because
too
then
much.
what are the things that people have to, again, going back to Maslow's hierarchy of needs, what are the things that people have to give up just so that they can make sure that they maintain their housing, right? Some people are not buying their medication,
Yeah. So unfortunately,
especially if you're on a fixed income, right?
yeah, unfortunately, if you don't have money to pay your rent and you don't have money to pay for your food, then the things that you have to give up are gonna have to go all to you to pay your rent. So you don't pay attention to your medication. You don't have insurance, so you don't have any money left for your needs. So no education, no vacation. Your mental health suffers.
Right.
So-
And that is going to impact your health, right? If I can't
It does.
maintain my medication and I don't have access to it, and as you mentioned, if I don't have health insurance, the
insurance.
cost for that is going to be, astronomical for some. And if people aren't able to maintain, it's going to impact their physical and their mental health. For an individual that might need medication for their mental health stability, if they can't get those meds, then we're going to see an increase or an exacerbation of those mental health conditions play out in our communities.
The other big barrier that we're seeing in folks when they are families is the high cost of childcare. So how, I'm going to have money to pay for childcare to go to work if cost of childcare is so high.
Right.
And we have identified that as a big barrier in some of the listening sessions that we have run.
Right.
So we listened that this is just something that parents with only one income is just not possible. Some parents just cannot afford
Yeah.
that.
And these are social justice issues. So these are some of the things that the panelists and keynote speakers that were at the social justice celebration that was put on by Harbor Care actually talked about.
Correct.
And it was really informative, to hear about some of the strategies and some of your folks. I remember Anthony Poore, he shared some data as well, and his data coincided with the data that you and ECHO presented. And so you gave the data from the public health perspective, ECHO gave the data on the health outcomes perspective, and those pictures did not look pretty.
None of them were positive, unfortunately.
Yeah. And so
But they were realistic, unfortunately.
I mean, and what we saw was data that was from 2023, I believe. Some of the data even spanned it over, a decade, but it showed you the decline or the increase in costs and the decline in the health benefits as a result of those things. And so when we think about those things as population-based people like we are, so public health focuses on, a collective impact approach, working with our partners and addressing from a population-based level those particular issues that vulnerable population members are facing, right? All of that was like shocking to us to see that, but it's not new data.
And as you experienced with me, the room was silenced. So we all know this because we live it. But when you see the numbers, it's shocking because it puts you to think and analyze what can we do in our reality. What do we do?
Right.
So it's time, in my opinion, it's time to stop, think about it, and take action. And the action part, I think it's important to reflect on it. And I encourage people to do the same process. Stop, think about it, and take the action. And the action should be contact your representatives.
Right, right.
And educate yourself and see what can you do from your end to make this happen and make a change.
Yeah. So one of the things I think is really important that we could probably do too is we could probably put some of those slides up on our website for the Division of Public Health and Community Services. We should make some of those slides available because people do need to be informed, right? They need to see what the trajectory looks like. They need to see what's changed over the course of time. One of the other things that people need to be aware of is during COVID, we had a lot of money come into our state. We had a lot of money come into our public health department. Those dollars aren't going to continue to be there because even with this new administration, and many people, even some of our viewers today, are probably watching and listening to the news. And we want you to check out reputable sources, though, because we want people to stay informed with the best and the correct information. Although information keeps changing very, very quickly, just as it did with COVID, we do want people to pay attention to what's going on. Now is not the time for any of us to put our head in the sand or be so overwhelmed with everything that's going on that we just shut ourselves off from it. Because when we don't make sure that we're staying abreast of what's happening, then we can get caught off guard. And with so many changes and so many things happening that impacts the work that we do, people's health matters to us. We're in the business of taking care of people. And so when we listen to these panelists talk about, especially when some of the things that they went through, for instance, Harvey Key is a Korean War veteran. And he talked about the fact of going to fight a war and then coming back to a country that didn't want him here. Now we're going through that now, and this is the 21st century, and we're at the space and place where we're saying who we don't want here in a country that was built on the backs of immigrants and enslaved people, and now we're saying we don't want these people here? So we come in and we build your house for you, and then you just kick us to the curb and just get rid of us, right? Those things will impact the health and well-being of individuals. Because when you've got people who are willing to work certain jobs that other people don't want to work, and then you remove them, what do you think is going to happen?
I just don't know what's going to happen, Bobby. I don't have an answer.
Well, what do we see happening now? We're seeing costs go up.
Definitely the cost has not go down.
Exactly.
And I see people concerned. I see people with mental health being declined. And I see people getting very anxious about, people very concerned.
And fear.
And fear, but people not taking action. And that is the part that I am trying to focus on. And the part that concerns me the most is people just not knowing. Right. Not being educated. And I think that's the part that concerns me the most.
And see, and that's where, so one of the things with public health, the primary prevention effort that we have in public health is putting information out there. Making sure that the correct information, not misinformation, not disinformation, but the correct information is put out so the public is aware, so that people can make informed decisions based on the best information that they have. Right. So that's why it's really important that I believe that the presentation that you did, that data should be available and should be on our website so people can see it. That we can continue to have these types of very open conversations about what we're experiencing, because it's going to impact us all. And there was a poem that I wanted to read that I don't have my phone and I can't read it. But it was actually a poem that was written by a Jewish person who was living in Germany. And I wish I had the poem.
But tell us the sense, because I remember the sense.
The pieces of the poem talked about when they came to take away this group of people, I wasn't worried about it because it wasn't me. And then they came to take away this one, and I wasn't worried about it because it wasn't me. Then they came to take away the Jews, and I wasn't worried about it because it wasn't me. Then they came and they came after me. And I really wish that I had brought my phone so that I could have shared that poem, because it is so important. If we really think that these things are not going to impact all of us, we're not understanding the truism of what's going on. because anything that's going to impact the least of our community is going to impact the majority of our community, right? There's not going to be, if you, we've never had it, and COVID was a really good example that showed us, COVID did not discriminate against. It didn't matter if you made money, if you were rich or poor. That virus wasn't saying, I'm not going to infect you because you have money. I'm not going to infect you because you're educated. I'm not going to infect you because you're a male. I'm not going to infect you because you're white. COVID was not discriminating against anything. And some of the things that are happening right now, although we may think that we're in a protected class because of our privilege, at some point in time, it's going to come around and it's going to impact all of us. And we can already see that. When you start cutting your federal employees without thinking about the work that they do and how it touches us here at the local level, we're starting to feel it right now. For instance, I'll give one example, and you probably remember this, when the individuals that worked for the agency that was providing the surveillance for the bird flu, and they were all fired. How are you going to fire the individuals that are providing their surveillance and providing you the data and the information of bird flu that is now increasing across the country?
Correct.
Oh, we made a mistake. Let's hire them back. We can't. Those mistakes are going to be costly for us. Cutting Medicaid. If the state of New Hampshire doesn't maintain a 90% of our folks in the Medicaid program, we are going to suffer quite a bit. There will be over 60,000 individuals that won't have Medicaid insurance. We don't think that that's going to impact their health and well-being. And if we think, oh, because it's happening to that person, it's not going to happen to me, we are so wrong. Again, I can go back to COVID. For people who didn't think that that's them that's going to get sick, it's not going to be me, we lost over 3,000 people.
When we talk about health, we're all losing. And that's the point. When we're talking about health, everybody loses.
Yes.
And I think that's a point that we're missing as a community overall.
Yeah.
Everybody gets impacted when it's about health.
I will tell you, in these last few, this last minute that we have, this is all very scary to me, Iraida, because it makes me think about a couple of things. It really makes me think about what happened in Germany with the Jewish people that were there, where these very subtle things were going on and people weren't really paying attention to the detriment that was occurring within that population until 6 million people were dead. And then it was like, oh, how did that happen? These very subtle things that are going on right now, maybe people won't be sent to concentration camps. Oh, but some will be sent to jail, right? But these things are going to impact us. And what does that say about us as a democracy, right? So these things impact the health of the public and our most vulnerable populations, and will continue every day.
Public health matters.
Public health matters. I want to thank you for being here today with us. I'm quite sure there's more conversations that we can have and will have about this very topic.
My pleasure.
Thank you. I'm Bobby Bagley, and I'm reminding you to have a great day today and a better day tomorrow. I'm also going to include on that something very important that Iraida said. And if we want to have the best days that we can going forward, we need to take some action. We need to let our voices be heard. We need to not be content with what's happening right now, and we need to get in contact with our state representatives. See you on the next Public Health Matters.